I think this was a really opportunistic kind of situation where I happened to be presenting on eReferral to a group of physicians. Just a intro explainer what eReferral is. And I find that even though narratives can be a little bit anecdotal, I know that my recent experience with eReferral on the patient side, which was actually the first time that I had experienced eReferral as a patient, felt that that might resonate pretty well with the group of physicians that I was working with. And I told them the story that quite recently I needed to get some imaging done. And the first round of imaging that my family doctor wanted to do with me was to get some x-rays. And at the time, he wasn't using eReferral, and so printed out a requisition form, handed me a piece of paper. He had to get his medical office assistant to call around to a number of imaging locations that may or may not be able to accommodate me in a wheelchair. And it ended up that none of the imaging locations locally had the capability or accessibility to accommodate my wheelchair. So we had to revert back to getting the x-ray done at the hospital. But because that referral form was already made out to the imaging center, we had to reissue a new requisition, and it was a whole thing. Unfortunately, I did need to get some additional rounds of imaging done. And this time my family doctor did have eReferral, and that was just a completely different experience, both for my family doctor as well as myself. The really cool thing about the experience that I had was how I actually needed two modalities. I needed an ultrasound and a bone scan. And so after I got off the phone with my doctor, who said, I'm going to send these requisitions in, very shortly I received an email in my own inbox letting me know that my doctor had made a referral and where it had gone. It was probably within a couple of days that I received another email from the eReferral system, not sent or manually had to be provided by any specialist or the referral receiver. Just by the nature of participating in the eReferral product, it automatically notified me that my referral had been reviewed, that the ultrasound was something that they were going to be able to do at that site, but that they were able to split that referral and the bone scan would have to be done at a different location. That didn't require another requisition, that didn't require a whole bunch of runaround. That requisition was able to be split and sent from within the eReferral system to the other site. And then I got two separate emails saying, you've been booked in for your ultrasound on this day at this time. Let us know if that doesn't work for you. And another email that said, we've got your bone scan booked in for this day and this time. And knowing what I know sort of behind the scenes, knowing that my family doctor was getting these exact same notifications. These were going right into their chart, right into their EMR. They didn't have to do any sort of review or triage. That information was just going to be available for them as soon as they need it when they're looking at my chart. So telling that story to this group of physicians, you know, we can provide the evidence that we want. We can provide all of the research, what have you, to show the benefits, to show the system benefits, but until you sort of, you know, give that human side of the story, that's what can really make people stop and think, this could be a technology for me.